Dr. Ann Pobutsky in this next presentation of the latest data from the Department of Public Health and Social Services. Dr. Ann, you there?
Yes, it says I can't start my video.
Hold on, we're taking care of that real quick.
Got it.
Hi, happy Friday, Doc.
It's been a brutal couple of weeks.
I'm just trying to keep it positive, but not COVID positive. Before we get into the presentation, we had Dr. Nathaniel Berg on the Physicians Advisory Group chair, and we had asked him a question about natural immunity. And his answer was pretty interesting, Doc. He had basically said that we kind of got it right, that they can't stop the spread, and so that's happening, but they're really focusing on the hospitalizations, vaccinations, and the treatments for the positives. Is that is that the play then, Doc? Because people have been wondering why we're not doing the same things we did last year to stop the spread of the positive cases, and so when we had Dr. Berg on, that was kind of what he said, was that the positive cases, the measures in place he felt will deal with those, but that the main effort and the main energy is going to go towards staving off the hospitalizations via the vaccine and the treatment.
And that could be because of what we're seeing now with the surge. So let me share a screen here. This is all the trends I'm going to show. It's updated, through the other day, and it's the same age groups. And somebody asked a question, how come we're not reporting on the transmission, and where is it? It's coming from these age groups, the 18 to 39 and 40 to 59. And as I showed last week, these are mostly Chamorros driving this. So these are, nothing has changed here in the past 3 weeks. But what has changed is the deaths. This is what we're seeing. And this is from the beginning of the pandemic to the present. And what we're seeing now is the same kind of deaths, 2 to 3 or 4 per day now that we saw year during last year's surge around the same time that trickled in to the new year. And what we're really seeing the past 2.5 months now, we've had 35 deaths. There's 3 more to be reported today. And 2/3 of them, more than half, almost 2/3, depending on the probables, because some we haven't verified, they're all dead on arrival. 5 have been fully vaccinated. Those are either very old people or very sick people. And 85% are unvaccinated. So they're dying at home. They're not getting a chance to get into the hospital. So that's probably why there's this concern about people who feel sick. No, it's not just the flu. It's probably Delta COVID. And you should, if you're elderly, you have chronic conditions, you're having shortness of breath after you've had some cold symptoms or not, go in and, call your doctor and see if you need to go to the hospital. The other thing I was going to show,
I noticed that it kind of, on some of them it said Pfizer, and then some of it didn't really say what vaccine.
Oh, did I miss that?
It's a combination. It's not all Pfizer. And again, for those fully vaccinated, 2 were really elderly, and at least 3 were very, very sick with severe comorbidities. So it looks like the vaccine might not help you if you're very old or you're very sick.
Right.
Someone else.
Or could it be that it's wearing off?
Yeah, because we just
we are exploring that. Yeah. We are exploring that. It's possible.
Doc, do you submit this data to the CDC, the breakthrough case data relative to vaccinated positives and vaccinated hospitalization?
We submit everything to the CDC. The cases. The CDC has only been tracking severe breakthrough cases that are hospitalized with severe disease. So yes, we do reporting on everything, and including the deaths once we get a death certificate.
So are you able to, just like, let's say the 27 people vaccinated in the hospital now, or how recent is the data you have? How many of them are fall into that category of severely ill?
as I pointed out in the previous 3 reports and the previous 3 weeks, there's a lot of cases in the hospital, and some are in the ICU, but it's not like we're seeing the ICU is clogged with patients. So that's likely a protective effect of the vaccination. I still have that slide. We haven't updated that. And we don't get complete hospital data, but you just had the hospital spokesperson on, she probably gave you an update.
Thanks, Doc.
These are reportable diseases. I just wanted to put this up too. People, last week, I remember someone asked, how did you know they're Chamorro? Or how do you know what ages are? And I explained that we have a master database because we report to the CDC all the time, all infectious diseases of public health significance. And that's why I put up the reportable disease list. It's not just COVID. We just now, because of the pandemic, have an entire COVID unit dealing with this entire pandemic mess. So this is just to give you an idea that public health does this all the time. It's just nobody's aware of it unless there's an outbreak that we report, like the dengue outbreak, like the Shigella outbreak, like this leptospirosis outbreak, and then, of course, COVID. So I just wanted to point out that public health counts all of these infectious diseases and reports them to the CDC. We have records going back to 1968 for what we report to the CDC as required. And Guam is not alone. We are all the states and territories report to the CDC all infectious diseases of public health significance, including COVID, Hansen's disease, you name it. So, how do I stop this? I'm having trouble here. There you go. And Chris is on a bathroom break?
Yeah,
Sabrina?
yeah. Were you able to talk about the data that was released yesterday, the under 11 data?
What about it?
Yeah, just if you don't have those slides so people can kind of see those and go through those.
I have to look for it. Hold on.
It's okay. I'm just wondering if we should be concerned because, it was a snapshot of August to September. Out of the 3,700 or so positive cases, at least 600, there it is, 607 were children, 0 to 11. The surge began on the 23rd.
We did that. We ran that data because the Physicians Advisory Group of the governor and the governor are wanting to see what's going on with the kids.
Mm-hmm.
And so here's the just regular testing.
Mm-hmm.
Again, somebody just asked the question about the hospitalizations. Yes, the hospitalizations have gone up, but again, you're not seeing that huge use of the ICU. And we have seen kids during the surge in the hospital and ER, and it's reflective of the surge, but we have not had one child die. Okay?
Mm-hmm.
And here's the age groups. And then, yes, let's see, those are breakthrough. We did some analysis of the kids.
Yeah, we're not seeing your charts, Doc. We got your desktop.
Yeah, Doc, nice desktop.
You can't see this?
No, it's your desktop screen.
Hang on.
No
Okay.
worries.
Lenovo's are nice
about
machines,
that?
though.
Yeah,
There we
there we
go.
go. Yeah. I seen that
Okay,
one.
this is the kids.
Yeah.
And like everybody else, we're seeing a lot more asymptomatic cases. Again, this is reflective of what we're seeing, mostly Chamorro, then of course, Filipino, etc. I think there's another graph on that. The reason we ran this data is because the governor and the Physicians Advisory Group were worried about what they're seeing in the U.S. and we haven't seen that same kind of. We've seen a little bump that's kind of gone down, but yes, the kids are getting infected, just like everybody else. But we're not seeing them in the ICU or anything, and there's been no deaths.
Right.
There's another way of looking at the ethnicity data. Again, it's being driven by the group that's driving the transmission, young Chamorros, 18 to 39 and 40 to 59. This is the daily case count among the kids. Yes, it's gone up along with everybody else. And it's skewing towards these older age groups, like 5, 6 and above, not necessarily small infants. Even though there's a few cases, it's...
Doc, when you honestly, when we put this data out yesterday and I took a look at it, I thought, oh, with this many cases, they're not going to reopen schools and face-to-face learning. But just looking at this data and parents looking at it, it's alarming, right? To know that we've had, hundreds of positive children from August up to now. So when you look at the data, what do you see and how do you explain it to parents that it's according to, well, like Dr. Berg had said, it's not that bad and don't be scared?
Well, I like to go back to the previous slides that show the history of this. Okay, this is an older report. There's 2020. Oh, this hasn't happened before. Yes, it did. The kids were infected last year as well. Okay, here's 2021. Here's our surge. And the kids are following that. And this has actually dipped down a bit. Again, if you look at the more recent report, there was a little bump up, and then the kids have gone down. So they are getting infected at similar rates, but we just need to make sure that whatever the schools are doing are keeping the kids safe, which means masking, social distancing. And I'm not involved with the details of what's going on with that, and I also do not make decisions. But we haven't been seeing children dying or, in severe straits at the hospitals, even though some have been going to the ER or a few might have been hospitalized along with this surge. So we were running this data so the governor could make informed decisions. We're watching this group and seeing what happens, just as we're watching to see if there's a decrease. But in the meantime, we're still seeing a lot of dead on arrivals, and we're really concerned about that in the community, about especially elderly people, mostly unvaccinated, middle-aged people too.
Yeah, saw that.
Yep.
Well, Doc, we're going to give you the floor here at the end because, again, with Dr. Berg and the PAG, the positive cases were alarmingly high, but he says the focus is going to be on hospitalizations and vaccinations. So what do you say out there to the community? Like, how should we be acting knowing that the positive cases are no longer, at least according to the PAG, a key component to the COVID response? Because we've kind of been trained to do the things that keep the positives from happening. I mean, it's not working, but I mean, this does kind of seem like a pivot, though, Doc.
Well, again, people are still having gatherings and that kind of thing that can drive this, and probably with their family or extended family, maybe they're having something. It's like we still need to mask and social distance. And if some people, younger people, feel they're not at risk, maybe they're still having social gatherings, etc. We still need to vaccinate everybody. If you're not sick, get vaccinated, okay? And we still need to do what we're doing. There's still the mask requirement. Now there's you can't go to a restaurant without being vaccinated. So maybe that's driving people to have parties at home. We still need to do what we're doing. And yes, the emphasis is on if you feel sick and you're old or you have chronic conditions, call your doctor and or go to the hospital if you're shortness of breath. I'm really not enjoying these keeping track of the deaths as we count the cases and count the deaths. I don't like doing this because it's a sad story, and 85% of the deaths are unvaccinated. So,
but Doc, how many of those
preventable deaths?
Right.
Preventable deaths, premature mortality. Even if you're old, you don't.
I get but were a lot of those unvaccinated deaths? Did many of them take place before we had the vaccine? Or are you only counting the unvaccinated deaths?
No, I'm only counting the, the total is still only 5. The 85% is of the past 10 weeks.
I see. Okay. Thank you.
Yes, because that's when we saw the first one was in early July. So I'm looking at July, August, September.
Right.
And out of those 35 deaths, there's only been 5 that have been fully vaccinated. And again, those were either very old people who have old age diseases and or middle-aged people who are very, very sick with severe comorbidities.
Thank you, Doc.
Thanks, Doc.
Thank you. I have to go.
We do too.
Any more questions?
No,
No,
we're good.
thank you.
Hopefully we'll catch up with you next week. Be safe.
Okay.
Okay, bye. All right, let's do it, Jason Solis. Are you ready? Stand by. KUAM, Facebook Live. The link, guys, get ready. Let's do it. Let's give away $500.